Hello to you. The next few hours look crucial for Barack Obama and the furious debate in the US over healthcare reform. It's a measure of how high the stakes are that he's about to address both houses of Congress, a rare event for an American president. He wants to extend health insurance to 46 million who don't have it. His opponents have built a powerful campaign on popular unease about government-run healthcare. As the BBC's North America editor Mark Mardell reports from Washington, this is Crunch Time.
His big day opened meeting the heroes of 9/11 in New York. The last time a president called on Congress to gather for a special address was in the wake of that terrible attack. He's now back in Washington, putting the final touches to this big speech to sell his hugely controversial idea that all Americans should have health insurance. In the build-up, he's admitted he's let constitutional niceties get in the way of clarity.
Out of an effort to give Congress the ability to do their thing and not step on their toes, probably left too much ambiguity out there, which allowed then opponents of reform to come in and to fill up the airwaves with a lot of nonsense.
I want to know if it's coming out of my paycheck.
At public meetings over the summer, opponents of healthcare reform made it clear they weren't just concerned, they were incandescent.
I don't want this country turning into Russia, turning into a socialized country.
While some compared it to communism, others said it was Nazi. Most controversial is what's called the public option, a government-run insurance plan in competition with the big companies. Today, the campaign gathered pace, petitions delivered on a hospital trolley to Capitol Hill.
In August, the American people spoke loudly and clearly. They didn't want government messing with their health care.
We will not see a government option, that we will not see a government trigger, that we will not see a government replacement of the healthcare system in this country.
We don't want our health care hijacked.
Student and part-time waitress in West Virginia, Johanna Ridenow, is part of the president's fight back. She's answered calls for people to come forward with their own stories. She may appear younger than her 24 years, but take a look at her hands. She has rheumatoid arthritis. Someone else has to open the bottle for her. Her original healthcare plan would have paid for $500 worth of prescription drugs a year. That would give her a 2-week supply of the most important medicine she takes. So to get the drug as part of a free program, she's had to give up health insurance altogether. But then she had a car accident.
Me and the passenger both should have died. I had to get cut out of the car. It was terrible, it was horrible. And my whole thought process was, I cannot get in this ambulance because I'm not gonna be able to afford it. And that's absolutely asinine. When did people become, I guess, so selfish to think that just because someone doesn't make as much money as them, that they should die?
At Congress, people are gathering to watch one of those knife-edge moments. Politics as high-wire public spectacle, what has been billed as a make-or-break speech for the president.
The BBC's North America editor Mark Mardell there.